Hello, I'm Hat, and welcome to Anecdote Thursday on All Hat, No Cattle. Those of you who have watched my earlier videos, or should I say have suffered through my earlier videos, know that I used to put an anecdote at the end of each of those. I believe the last time I did that was at the end of the third You Can't Ask That Fat video. Feel free to go back through the catalog, skip to the end, and listen to these if you so dare. I say this because some of the earlier videos referenced a previous job I had as an emergency room technician at a level 1 trauma center just outside of Chicago. To delineate, my job was basically making sure all of the rooms were stocked with material other than drugs, which were needed to treat patients, plus be a member of the trauma team, and that required me to be present whenever the really bad accidents came in, and I assisted the doctors and nurses in treating those patients. Sometimes all I did was cut off their clothes or run labs downstairs, but it had to be done immediately, and it had to be done well, because there were no second chances. It was an honor to be on the trauma team, and I relished it. Now, why all this backstory? Because this is a trauma story. I'm not telling you this story because I want you to think that I am the fastest thinker on one's feet in the history of emergency rooms. I'm not telling you this story to make myself look great. In fact, I think it shows a level of callousness on my part. Some people think that's a good thing in emergency medicine. I'll leave you to judge. So the title of this episode is, well, there's not going to be a title. I'm going to let you walk through it to the end, and then know that no title I could have come up with wouldn't have given it away. With that said, let's get to it. I worked third shift in the ER, which is a tough shift if you're used to sleeping at night, but is the best shift if you want to see the incredible insanity that man can commit upon himself and upon others. This particular incident started with a motorcycle ride. Two young gentlemen doing what you do best on a motorcycle, careening down the Eisenhower Expressway at an overly high rate of speed, with both of them having an overly high amount of alcohol in their systems. Of course, the way these things work out, the drunk one was driving, while the slightly more sober one was on the back, hanging on and having fun. Until they hit the guardrail. Hard. They flew off the bike, it spun out into traffic, and they were both lying there in the gravel and tire dust, beat all to hell up. The ambulances arrived, and the driver was taken to another hospital, where he was pronounced DOA. The passenger was more fortunate. He was scraped up pretty badly, but his main injury was an amputation. His right leg was cut off just below the knee. As these things work out, I was tasked with making sure that the leg was prepped for surgery. I know that sounds crazy, but it's actually a thing. What you need to do is harvest skin from the amputated limb in order to cover the stump that's left behind by the amputation. This is known as an autologous skin graft. Otherwise, you would have to cut skin with a very interesting device off of a place like the back of the hip, a very painful procedure. Now, if you can take the patch from a fresh limb, one that's no longer attached, it's a win-win. Interestingly enough, the leg came in first. When you think about it, how would you like to be transported in an ambulance with your severed leg laying on top of you? So yeah, it had to come by separate cover. The leg was presented to me, and you'd be surprised how much a lower leg weighs. I won't guess, but at least 20 pounds. I wiped down the leg with an alcohol solution to sterilize it and clean it as best I could, and then I put it inside a sterile plastic bag. That bag went inside another bag, which was filled with ice, to keep the limb cool, to keep things from breaking down due to heat. Not very long after I got the leg on ice, the patient was brought in. Now, you would expect someone in this situation to be absolutely out of their mind, but he was fine. Very calm, very cool, conversing with the doctors and the nurses. I wasn't near him. I was maybe 8 or 10 feet away. He could see me, but he was busy talking with everyone around him, so he was paying me no mind, which was good because his leg was lying there right in front of me. Then the conversation turned to what was going to happen next. And the doctor explained they were going to take him to surgery, and they were going to clean off his stump, which is known in the industry as debridement. And once they debrided the wound, they would patch him up. And then he asked the question, so after you clean off the stump, that's when you reattach my leg, right? It got really quiet. And the doctor said, well, no, we can't do that. It's too large of an amputation. There's no way we could reconnect everything. You've lost that leg. Now the panic sets in, and this guy loses it. He is coming off the gurney, or what we call the cart. He's coming off the cart. He is thrashing around. He's grabbing at doctors. He's grabbing at nurses, and he's trying to get up. He's trying to run out of that room because he has nothing left by way of sanity. He's gone. Now, normally in a situation like that, it would be my job to restrain the patient. And we had what we called soft cuffs that we would tie around their wrists and ankles, or ankle in this case, and then tie those to the sides of the gurney, thus holding the patient in place. And the head nurse, my boss, turned and looked at me and yelled, "Hat, get this guy restrained." And the patient looked towards me, and we actually locked eyes. The patient and I were staring straight into each other's eyes. And I said calmly, but loudly, "Let him go. How far is he going to get?" And the patient was staring right at me, and he calmed down instantly. They got him up to surgery. After that, I don't know what happened. I know I didn't get in trouble, so I guess the leg worked out okay for patching the stump. Now, I know what some of you are thinking. Why weren't you fired for that? And you know, if it had been a normal workplace situation, I would have been fired. I should have been fired. But in an emergency room, especially in a level 1 trauma center, where you see all of the worst shit, that kind of humor is expected. And to be honest, my boss said, you know what? That was really quick thinking. You told the guy that there was no way out, and he had to deal with the situation. You brought him back to reality. So that's it. I hope you enjoyed this. Let other people know if you did. And if you hated it, let other people know that you did. If it gets around, all's the better. So until I see you all again, please be well. And as always, thank you for your attention.